All right, welcome back to Eyewitness News at noon. Dr. Mark Simpson with Simpson Dental Associates joins us now for our Ask the Dentist segment.
Always a pleasure.
Absolutely. Good to meet you.
Well,
and
thanks.
I'll tell you what, if you've got a question for the doctor, you can call the number right there on your screen. But you've got an interesting event coming up tomorrow at your office.
We
correct?
do. We have a dental seminar that we're going to have, and we've had several of these in the past. We're going to have a special guest, actually, that will be attending. One of the people that came to our last seminar that had the work done. There's the actual number to call. We do have a pretty full house, but we are holding a couple positions open so that anybody that wants to come. The other advantage is that you get a certificate that is worth $538 for attending towards the treatment that you may need. And the great thing about it, the great thing about the seminar is that it gives people an opportunity to find out how implants are used, because there's a wide variety of ways that we use dental implants.
Okay.
And some of those are to support a single tooth, maybe to support a denture, maybe to support a partial, a wide variety of things that will allow us to help people be able to chew their food better. One of the guys that we had on here at the seminar last time that came to be on the TV show with me,
sure,
you could see how he had lost so much vertical dimension. You see, when you lose a tooth, that bone just starts shrinking away, and once that bone shrinks away, it's gone. So it's very interesting that once you place the implant, because it's attached to the bone, then it will keep the bone in place. So people that have trouble wearing a denture, for instance, or have a partial that won't stay in place, a lot of times implants can be used to replace those missing teeth. So it's a great way for you to ask the questions that you might not otherwise be able to ask, and you do, with a certificate, get the opportunity to get a free consultation, and also we'll review your CT scan. A CT scan is a three-dimensional x-ray that allows us to be able to look at the bone and see exactly what's going on so that people know exactly what to expect.
In seminars like that, that really provides a service to your potential clients, correct? I mean, what do people say that attend them?
Well, they're very impressed. They always come back and say that they got their questions answered, and that's the main reason for us to have it.
Okay, let's go to the phones. We got a call from Kenny. Kenny, what's your question for Dr. Simpson?
Implants for partials. I've got two of my back teeth hold the partial in. I have to use Fixodent to hold it in my mouth. But I want to keep partial, but I want to get the implants for my partial.
Well, you may. I don't know, how many teeth are you missing?
Got two jaw teeth, one on each side, and two front teeth.
Okay. Well, it's possible with just a few implants you might be able to get rid of the partial altogether. So that's one option that you would have. The other is that it could hold the actual partial, but most people that have partials aren't too crazy about them because they tend to trap a lot of food. So if there's a way to get rid of that, you probably would be interested in that once you saw how much more comfortable it is.
Sure. All right, we got a call from Terry. Terry, good afternoon. What's your question for the doctor?
Yes, sir. I have a problem with gritting my teeth. I grit them constantly. I can't hardly stop.
Well, what we found is that it's kind of a proprioceptive mechanism. In other words, a lot of time it's because your teeth don't fit together properly, and that spurs you to kind of clench and grind them, even though you're not aware of why you're doing it. A lot of times it's to try to get the bite to fit together properly. So I would say that most likely what happens is that you have some sort of a discrepancy in the way your teeth come together, and then you're grinding, trying to get them to fit together. So a lot of times what we do is test it out first by giving you a splint, and if that then solves the problem, we know that it's a malocclusion then, and a lot of times it's a matter of moving teeth or changing teeth or adding or subtracting from teeth in order to get the bite to be correct. But the trouble is you're going to wear your teeth down to nothing if you keep doing that.
All right. Dr. Simpson, thanks for coming in.
It's always a pleasure.
A lot of good questions, covered a lot of ground today.
Yeah, absolutely.
All right, well, stay tuned for a look at the top stories and a check of your weather.